Ketamine works on the glutamate receptors in the brain, and that's different to common antidepressant medications, for example, like SSRIs, which work on serotonin receptors in the brain. So we understand that ketamine can offer an antidepressant effect via a different pathway. Ketamine is not a classic psychedelic. Ketamine is in the category of a dissociative anaesthetic. We don't deliver ketamine in anaesthetic doses. We dose far below that threshold, but certainly our clients will experience some dissociative effects, and what I mean by that is perhaps a kind of out-of-body experience. Importantly, we also understand that ketamine can help with neuroplasticity. So that is increasing connectivity in the brain, so within and between brain regions, and also synaptic growth. And so again, that's really useful for psychotherapy. It really augments the therapy process. People can take new perspectives on familiar problems and behave in more adaptive ways that make them perhaps move forward in their life in ways that they've really struggled to previously. When they've previously felt really stuck, they manage to take that kind of springboard towards the life that they want to live. You can go to some difficult and dark places, and there is that sense that it can be really helpful to allow yourself to go there, and that's because perhaps your difficulties are maintained because of your avoidance or your attempts to avoid going to dark places, which of course is really understandable why you would try not to do that. So with the ketamine experience and those dissociative effects, you're allowing yourself to be there. But what we think might be really useful and protective about that separation that dissociation gives, that kind of not quite being in your body, is that you're not fully experiencing it in a way that feels so overwhelming, so that you can experience pain and difficulty, but you stay inside your kind of window of psychological tolerance, so you don't feel overwhelmed, but you're also ideally not so cut off that you don't feel anything at all. You're just in this useful window of tolerance, which what we understand psychologically and therapeutically can really help with processing trauma, for example, or just psychological difficulty. We are now experiencing what is become known as the psychedelic renaissance, so we are thankfully now able to conduct good quality research with these compounds to demonstrate their potential benefits. There probably is some stigma attached potentially to using something like ketamine, which can be used in recreational context to treat mental health problems. But I think awareness and understanding is growing as research develops and as we start to use these compounds in clinical settings, or as we start to use ketamine specifically in clinical settings, that recreational use and clinical use are very different sides of the coin. So we're using it in a highly regulated fashion. It's extremely safe, and it's, I would say, not comparable